End-stage refractory multiple melanoma. Multiple melanoma is a malignant disease of the blood, accounting for 10% of all hematological cancers and 1% of all cancers worldwide, predominantly affecting the elderly and has no known cure. The disease is characterized by the spontaneous proliferation of monoclonal plasma cells in the bone marrow and is considered a lymphoproliferative B cell disease by the World Health Organization. This mutation leads to the formation of non-functional intact immunoglobulins or immunoglobulin chains, resulting in a variety of complications. Multiple melanoma is characterized by the diagnostic manifestations of organ damage, abbreviated as CRAB. This includes lactic bone lesions, hypercalcemia, anemia due to low hemoglobin levels in the blood, and renal impairment. Additionally, diagnosis has been split into 3 stages, dependent on the severity of the amount of myelomal cells present, damage caused to bone by myelomal cells, level of M protein in blood and urine, blood calcium levels, and albumin and hemoglobin levels. During this presentation, we'll be specifically discussing treatment options, both current and future, in terms of end-stage refractory multiple melanoma. Now over to Lakshay to talk more.
Thank you, Holly. As per the 2018 research named Global Burden of Multiple Myeloma, the number of cases worldwide were close to 140,000, with almost a 126% increase from 1990. It is also to be noted that the countries with mid-tier income and low socioeconomic development contributed most to this increase, as the treatment options and availability is very limited. The 3 main factors which contributed to this percentage increase in cases were population growth, increase in aging world population, and an increase in specific Now we move over to some Australian statistics and numbers. According to Cancer Australia, multiple myeloma was estimated to be the 17th most commonly diagnosed form of cancer and the 16th most common cancer death in Australia in 2019. Now, when it comes to gender disparity, there isn't a huge difference on which gender is more prone to multiple myeloma, as the population split is nearly 50-50, as this is represented in the figures presented on the slide. It is also to note that currently in Australia, the risk of an individual to die from multiple myeloma by their 85th birthday is 1 in. Now we're looking at 5-year survival rate percentages from the years 1986 to 2015. As we can see, the years 1986 to 1990 had a survival percentage of only 28%, and as we move over to 2011 and to 2015, the survival rate has increased almost twofold at 51%. Now back to Holly for some amazing information on factors influencing treatment options for refractory.
Base regime or a triplet drug-based regime.
Current treatment of multiple myeloma is determined by the classification of the patient as either fit, intermediately fit, or frail according to the IMWG frailty score. The standard treatment for newly diagnosed patients is high-dose therapy and autologous stem cell transplants. Protease inhibitors combined with the immunomodulatory drug lenalidomide and dexamethasone is the current triplet therapy used for most patients. The current protease inhibitor is bortezomib. The new protease inhibitor being introduced and commonly used is carfilzomib. Carfilzomib works in a similar way to bortezomib, however, contains less negative side effects overall. Other new treatments include histone deacetylase inhibitors, which prevent histones from forming and also allow for gene expression by unfolding the proteins, and monoclonal antibody therapy, including the two monoclonal antibodies elotuzumab and daratumumab. Elotuzumab works via antibody-dependent cellular cytotoxicity, while daratumumab works via complement-dependent cytotoxicity. Other new treatments that have been introduced include checkpoint inhibitors such as nivolumab, vaccines such as PVX410, and chimeric antigen receptor T cells. RAF inhibitors are part of the new future treatments under clinical trials right now. RAF inhibitors such as sorafenib inhibit the vascular endothelial growth factor and the RAS-RAF-MEK-ERK pathway, which allows for the uncontrolled growth of tumor cells. 3 to 5% of all patients with multiple myeloma end up with BRAF mutations. As such, BRAF inhibitors such as verumafenib are being tested to combat this. Kinesin spindle proteins such as ARRY520 arrest the cell in mitosis and cause apoptosis. AKT inhibitors and BH3 mimetics are also being investigated. Finally, and most importantly, isutaximab and MOR202 are two new monoclonal antibodies being tested. These are most important as monoclonal antibodies are looking like being the predominant way of treatment going forward.
Now let's meet Pamela. She's an end-stage refractory myeloma patient that went through clinical trials after previous bortezomib dexamethasone treatment and autologous stem cell transplants became ineffective. She's now being successfully treated through isutaximab and MOR202. Now let's hear from Pam.
This was a good thing for me to try a clinical trial. Well, they explained everything to me very well about what would happen, but the clinical trial helps so much because one of the drugs I'm using now, I used in the clinical trial. So if it helps other people and everybody there on the days I go has the same disease usually, then I'm happy for that.
Thank you, Pam.